let's start the last station. I'm only talking about the integrated station and the anatomic part of this integrated station. So in this station, we are going to have the endocrine organ, which include the thyroid, the adrenal gland, and the pancreas. So these are the three important structure that you have to know. First of all, you have to identify the thyroid gland. What are the different parts of the thyroid gland? In the midline, we have the isthmus, and then we have the thyroid lobe. What are the surface of the isthmus? We have only anterior surface and the posterior surface. While for the thyroid lobes, we have three surfaces. We have the anterolateral surface, medial surface, and the posterolateral surface. Anterolateral surface sometimes is also called as anterior surface, so don't get panic. So these are the surfaces, and then you might be asked to mention some relations of the medial surface, anterior surface, and the posterolateral surface. Posterolateral surface is having very important relation, and that is about the content of the carotid sheath. So you should know also about what are the content of the carotid sheath. Then they might ask you to identify this blood vessel. This is superior thyroid artery, which is coming from the external carotid artery, and this is, here we have the thyroid membrane, and this is internal laryngeal nerve and superior, this is internal laryngeal nerve and superior laryngeal artery, which is a branch of the external thyroid artery. So this is external thyroid artery giving this superior laryngeal artery, which is piercing thyroid membrane. So this is about the thyroid gland, identification of different parts, the blood vessels which supply the thyroid gland, the relation of the different surfaces of the thyroid lobes, and the blood supply. So this is about the thyroid gland. Then the another endocrine gland is the endocrine gland, the adrenal gland. And so you have to identify the right adrenal, which is the pyramidal in shape, and the left, which is the semilunar, which is concentric on the top of the left kidney. So first of all, they'll ask you the adrenal gland. So you have to identify that this is the right or left, and then they'll ask you about the relation. So for example, if you see here, this is the right suprarenal or adrenal gland. The posterior relation is the diaphragm. Anterior relation is, we have here very important, inferior vena cava. Similarly, they might ask you about the veins, the suprarenal vein, which is in the right side, it is going to the inferior vena cava, and on the left side it is going to the left renal vein. So this is about the adrenal gland. Now apart from the adrenal gland, we have another endocrine gland, that is the pancreas. So they'll ask you to identify this gland. So this is pancreas. What are the different parts of the pancreas? So pancreas is having the four different parts. One is the head, which is in the concavity formed by the second part of the duodenum. So you can see this part is the head, and then we have the neck. How to identify the neck? In the neck, you will see on the posterior surface, you will see some very important structure, and then this structure is the portal vein, which is formed by the splenic vein with the superior mesenteric vein. So this is the splenic vein, and this is the superior mesenteric vein joined together to form this portal vein, which is in the neck of the pancreas. So this part is the head, this part is the neck, and then what is this vein is? Now this vein is draining inside the splenic vein, so this is inferior mesenteric vein. Remember that the portal vein is formed by the splenic vein as well as the superior mesenteric vein. Then this is the neck, this is the head, which is inside the concavity formed by the second part of the duodenum, and then we have left to the neck we have this the body of the pancreas, and the last part you will see the tail of the pancreas, which is in the lino-renal ligament, which is so these are the different parts, and then they'll ask you to identify this structure. This structure is very important here. You can see that this is the main pancreatic duct, and then this main, as you trace it from far away to the second part of the duodenum, it opens inside the second posteromedial wall of the second part of the duodenum in the major duodenal papilla. Now, apart from the main pancreatic duct, we have also the accessory pancreatic duct, which opens inside the minor duodenal papilla. Now, apart from the head, neck, body, and the tail of the pancreas, we have another important structure that is called uncinate process. So here, this extension is called uncinate process of the liver, and you can see that these superior mesenteric vessels are passing anterior to the uncinate process of the pancreas. So this is about the pancreas. I'm just telling you about the different parts. The skill part, you might have the knowledge part, and you have to read from the lectures or the resources. Thank you very much.